One of the things that we would want to evaluate for is to just make sure there's not an underlying autoimmune process that is going on. Whether the skin rash that you've got is psoriasis, if it is, then obviously, a workup for psoriatic arthritis would be a good idea. And, there's things that we would, do in our initial intake, in our lab work, our evaluation to help tease that out. One of the interesting things is that exercise is really beneficial for most patients who have autoimmune inflammatory conditions like whether it's rheumatoid arthritis or psoriatic arthritis. And so some patients won't notice that they have those clinical manifestations, so joint pain, until they stop exercising, right? Sounds like with the closure of your gym, and now all of a sudden the symptoms that were not there before because exercise is actually anti-inflammatory was being really helpful. So I specialize in the non-inflammatory musculoskeletal concerns. So patients who have, overuse injuries, they have osteoarthritis, that type of stuff. If we start working together, because there's enough here that it sounds like this could be mechanical in nature, meaning it could be an overuse injury, it could be an old injury that never fully healed. So if my physical exam, my initial intake says, hey, I really think a lot of this is more of an autoimmune stuff, then my wife, who also practices here, like we practice together, she does a really, really great job at handling more the autoimmune, the systemic concerns and complaints that patients have. And so if you end up, coming into the practice and seeing me and it's not a great fit to work with me, then it's a referral over to her. So you're still in the same location, all that type of stuff.
Yeah, that sounds good.
Okay.
I should mention actually when you're talking about autoimmune, and I don't know whether this is, there's any crossover, but my dad's got MS, so there's that.
Okay. That's a good, important piece of information to know and something we can tease out during the initial consultation to see if there's any signs of that in you. Generally does not present with shoulder and ankle pain, but obviously all that stuff is important to know.